Hello, and welcome to Mental Health Matters. I'm Edgar Wiggins, your host for this program that is dedicated to providing you with practical and useful information regarding mental health and related issues. Over 17 million Americans suffer from depression. This illness can have devastating effects on the individual, their family, and the community. To help us understand what we can do is Dr. Annelle Primm, who's been a practicing psychiatrist in the Baltimore area for over 20 years. Welcome to Mental Health Matters, Dr. Primm.
Thank you, Edgar. It's a pleasure to be here.
Let's start out by talking about how significant a problem depression is in this country. I said over 17 million Americans suffer from this, which is pretty amazing. But beyond the, how does this illness affect our country?
It affects it in so many different ways. First of all, the symptoms of depression can affect the quality of life of individuals. It makes it difficult for them to sleep, makes it difficult for them to concentrate, focus, or function in their roles, whatever they may be, as a student or as a parent or as a spouse. It can even make people think about taking their lives, which makes depression really a lethal illness, potentially, if it's not recognized and treated. It also has associations with other illnesses, like the chronic diseases, high blood pressure, diabetes, HIV/AIDS, and so forth, cancer. Many of these conditions have higher rates of depression, and of course, as you can imagine, can make it very difficult for people to take care of themselves, to follow a treatment plan from their doctor, to follow a certain diet or exercise, or even just to take medication.
But let's step back for a minute, because when you think about this, the issue of depression, and you think about it as an illness, what does that mean? Because depression is one of these words that is used in everyday speech all the time. Well, how you doing today? Well, I'm a little depressed. But the kind of depression that you're talking about is not like that. It's not a transient change in mood. It's not a limited feeling of sadness. I mean, what is it that qualifies this as a medical illness?
Well, diseases are usually what we call a cluster or a group of symptoms, and in depression we do have that. And the cluster usually revolves around a change in mood, a change in how people feel about themselves, or self-attitude we sometimes call it, or self-esteem, and also a change in their sense of well-being. So a person with depression would be sad, or perhaps they might be irritable or very anxious. That's the change in mood. The change in their sense of themselves or self-esteem, they may be very self-critical, blame themselves for things, be extremely guilty, just feel like they're not worthy of living. And in terms of the sense of well-being, they just may feel tired all the time, not feel like doing anything, not want to interact with others. So a person may have any one or more of those sorts of symptoms in each of those categories to qualify for depression, and it may present differently in different people, but what must occur is that people have symptoms in each of those three categories in order to qualify for an actual diagnosis of depression.
So we're not just talking about I woke up today and I'm feeling a little under the weather, I'm a little irritable. You're really talking about something that occurs in various spheres over a period of time. Exactly.
In fact, to meet the criteria, as we say, for depression, a person needs to have five of certain symptoms of depression within a 2-week or more period in order to really meet that diagnosis.
What causes this? What causes depression? Does it have to do with early life experience, the way that you were raised and treated by your parents or significant others, early experience? I mean, what's the cause of this?
Well, we don't really know exactly what the cause of depression is. We do know that it runs in families, and that if you have a relative, a parent, sibling, even grandparent, aunt, uncle, etc., who have had depression, that your risk of having depression is higher than someone who does not have relatives with the illness. But we also know that that the environment can certainly pass on a certain amount of risk for depression as well. That people who are living in poverty have a higher risk for having depression. And I'm not saying that if someone is poor that they will be depressed, but it seems that negative life experience somehow can trigger the expression of depression in people who are vulnerable to it. There is a particular health condition that can cause depression, and that is stroke. And in fact, I often talk about there's one type of depression that I know how to prevent, and that's the depression caused by hypertension that's untreated or undertreated and then leads to stroke. And depending on what part of the brain the stroke affects, the individual may have an actual depression that has nothing to do with the sadness maybe associated with having a serious illness like that. So it's definitely a brain disease, and we know, certain parts of the brain are affected when people have this illness.
Well, when you talk about brain disease and parts of the brain being affected, are there also, there's a lot of discussion about chemical imbalances, certain substances being lower or higher in the brains of depressed people than of the rest of the population.
That's true. Some of the most common types of neurotransmitters, as we call them, brain chemicals, are serotonin and norepinephrine, and they are in certain amounts in everyone's brains. But in people with depression, there are some imbalances, in particular with those chemicals that can cause the individual to have a change in mood and the other associated symptoms.
So in addition to all of the things that you talked about in terms of mood changing, these other cluster symptoms, there also, though, are real changes in brain chemistry.
That's correct. And what's interesting is that we're finding that there are changes in brain chemistry in response to certain stressful events. And so we know that having depression is not simply just an internal biological phenomenon, if you will, but there are also external events that can affect the brain and the brain chemistry and result in depression.
So then stressful events in one's life can trigger changes in our biology.
Exactly.
And if folks are at risk for this particular illness, then those are the kinds of situations that interact and people become depressed.
Yes.
Well, that leads me to then to go back to some of the comments that you made earlier about the relationship between depression and certain chronic diseases. How do they interact? I mean, diabetes, you talked about a bit about hypertension. I mean, these are significant diseases. Not only are they significant for all of the population, but we know that certain cultural groups, if you will, certain ethnic and racial groups have a higher incidence of these chronic diseases.
Yes, that's correct. With diabetes, for instance, which is a devastating illness that affects millions of Americans also, there is an association with depression. In fact, a person with diabetes is twice as likely as someone without diabetes to have depression, and it works the other way around. A person with depression is twice as likely to have diabetes than an individual without it. So if we look at the brain, the part of the brain that controls certain hormones like insulin and stress hormone, we see that it's affecting the same part of the brain that that depression affects. So there seems to be some sort of coexistence of some of the same chemicals going on with both of these diseases that seem to sort of predispose to each other.
But wouldn't that also suggest that there's kind of an interaction between these diseases? With these illnesses, I mean, in the same way that we often talk about, addictions and substance abuse,
Yeah.
and that these are real problems, especially for people that have mental illnesses, especially mental illnesses like depression.
Yes.
You and I and others have often talked about people medicating their depressive symptoms with alcohol and with illicit drugs.
Yes.
And so now you're adding a whole nother dimension of actually these other chronic diseases. Wow. It's a bit overwhelming.
It really is, and I think the fact that depression is still stigmatized along with other mental health problems, that the fact that there still is a lack of recognition of the illness, a lack of awareness among many people, that it may increase the negative outcomes associated with some of the chronic diseases. We know that people who've had a heart attack, if they're depressed, that if they don't get treatment, their outcome is going to be poor. They may die sooner than others who don't have depression, or die sooner than others who have depression and get it treated. So there are many associations out there, and it's not hard to believe that not getting treatment for an illness that can affect your energy level, your outlook on life, your ability to sleep and to have a sense of well-being could also affect the course and the outcome of another illness that you may have. The two together is really a double whammy. So I think it just really raises the need for us to be more aware of depression and other mental health conditions so that we can maximize people's overall health. I don't think people had an awareness of this before, that mental health really has an impact on your overall physical health.
But when you talk about people living in poverty and there being some association with that as well, and when we begin to think about how often minority groups have a higher incidence of living in poverty, and also have often a real lack of access to good quality medical care. I mean, I would think that these would be special concerns for our poor and impoverished minority groups.
Absolutely, and these may be some of the things that contribute to some of the disparities that we see in health status and in outcomes and death rates and rates of illness that we see so high among some of the racial and ethnic minority groups. So it's really incumbent upon us to find ways of intervening, of being more aggressive about identifying mental health problems such as depression in these populations, and making sure that people get treatment so that we can improve their overall health and hopefully eliminate these disparities.
Well, we're going to have to stop for a short break, but when we come back, I really want to move our discussion to what we're doing, because I think we really need to talk about the positive strides that you and others are making in terms of dealing with and combating some of these issues. So, after the break.
Great.
We'll be right back.
In our nation of plenty, 1 in 5 children faces hunger every day. America's Second Harvest feeds 23 million people every year. 9 million are children. Help feed a hungry child. Volunteer at a food bank or pantry. Organize a food drive at your school or place of work. Get your friends and co-workers involved. Visit Second